My name is Dr. Ruth Senyonyi. I'm a counseling psychologist and I work with Bank of Uganda at the moment. I have dealt with several sickle cell patients. I call them clients, not patients. And so I have some little bit of knowledge about what they go through and what has happened to them and how they are dealing with this issue. Warriors definitely need to deal with anxiety and discomfort that comes with this disease, because those are the two most prominent things that happen with sickle cell. You are anxious and there's a lot of discomfort. How to deal with them? It's important to divide these two things. Anxiety is to do with the mind, with the thoughts, how to handle that. Many times it's difficult to tell someone else, how do you manage your thoughts? So that's one of the most difficult times. And yet the discomfort is more of physical, and that can be you sit like this, do like this, take this, drink this, or don't drink this, or sit like that. So the part that I work with is mainly with that, the thoughts, the mind, how to deal with that is the part that I work with, how to help them. Now, when you think of anxiety, it is things that are coming into your mind, how you are thinking them and how you are processing them. So, a process of how to manage that process. Some things are coming in. Is there an ability to stop the thoughts of fear, of anxiety, of what will happen to me tomorrow? How am I managing this pain? And the whole processing of it before they go out. That is the process that we manage. Sickle cell has taken a back seat simply because people don't know much about it, or they don't want to know much about it because there's a lot of stigma associated with it. It's like, if I have sickle cell, I'm not going to mention it. I'm not going to tell my children. I'm not going to say nothing about it because of the stigma related to it. So you find that people don't speak about it. People don't want to know. People don't, and it's a long-term disease, chronic, yes, and you don't know when it's going to end. That's why it's definitely a backseat, and that's why we are doing all this, to bring it to the forefront so that people are aware about it. What contributes most to sickle cell anxiety is fear. When fear grips you, sometimes it paralyzes you. You really can't do anything about it. So fear of things like death. If this pain comes today, am I dying tomorrow? So you are paralyzed with fear. So you don't know exactly how to go on from there. Fear of the increased pain. Will it increase? Will it reduce? When I grow older, will it be better? How do I manage the stigma? How do I manage the pain? There is no prescribed way of managing the stigma and managing the pain. They can tell you today, do this, but tomorrow it won't work. So it creates more panic, creates more fear. And sometimes people tend to give up and say, I'm done. And then when you give up, it leads to sadness, it leads to depression, it leads to so many things. So it's just a culmination of so many things that contribute. There are things like, what will others say? If I complain today, I complain tomorrow, next year I'm still complaining. People say, why don't you stop complaining? Why don't you stop telling us about the pain? Why don't you, yet the person really doesn't have control over that. So that having no control, most diseases are controlled. If you have high blood pressure, there is medication which brings it to a certain level, then you go on with life. With sickle cell, you don't know when the attack is going to come, why it's going to come. You try this and you try the other, and the attack still comes. Some of the other contributions are isolation. Sometimes you give up, friends give up on you, you give up on friends, family gives up on you. And so when that happens, it also contributes to the anxiety. Questions about the future. We've had people, am I going to live? Am I going to die? When am I going to die? is a very real question when you're a sickler. 25, will I make 25? 35, will I make 40? You know, those are very fear they bring a lot of anxiety. You know, it's real in the heart, and you really can't voice them out many times. It's not like you can discuss it with anybody else. Am I dying tomorrow? Am I dying today? Am I dying in 5 years? I mean, we all have those questions, but this one is a real right on the forefront. What I would like the medical side to focus on is pain management. Like they've done for cancer, I think there needs to be a way of managing pain. Because when a sickler complains of pain, sometimes the doctors don't know what to do. The parents think he's faking it and just go to your room and sleep. Tomorrow we'll think about it. It's not about that. But how do you manage pain without getting addicted to the painkillers, to whatever is being given to you? How to manage pain. And two, how to manage anxiety. Because as a counselor, sometimes I prescribe things and say, do this, do that. But sometimes you feel you are saying things and there is a limit to what they can do, really, to manage anxiety attacks, panic attacks, depression. It's sometimes hard. I would also like to draw the attention of the sickle cell patients to what are their decisions in regards to marriage. Because, I'm really into premarital counseling, marriage counseling, and you find that some people go into marriage without having discussed this issue or having done tests or thinking about whether to have children. So these are conversations that need to be pulled up and talked about, especially with the sickle cell patients. The limitations about handling stress, I think, is basically about I'm tired. I came to you yesterday, we discussed how to handle stress, but this is too much. I've got to the level I'm just busting. I'm out of this. So it becomes really difficult for them. I don't think it's difficult for the person giving the advice or talking to them, but there needs to be a constant, like almost a daily conversation with this individual. Now you find that as a counselor, I can't do that for you because I can't deal with you on a daily basis. I have other clients that I'm dealing with. The doctor has other patients that they're seeing. The family has other things that they're doing. So, and yet this is a daily occurrence. The kind of mental health problems that they might face, I think the biggest one is depression. Depression, we can go into panic or anxiety attacks because of the things that I've talked about. They are very, you get fearful, you get anxious. Every day you're looking ahead and it is just fear. It's just anxiety. So you can easily get into a panic attack. Every time you step out, you can actually get an anxiety attack or a panic attack. So eventually you decide, I'm not going out, I'm not going to meet friends, they're going to ask me this, I'm not going to be, when I'm 30, they're going to ask me whether I'm married, I'm not yet married. When I'll be asking myself whether I'm going to die. So every time there is something that you're anxious about. And then it leads into sadness. Depression is, I usually describe it as a depth of sadness that you really can't get out by yourself. Because you are so sad, you are so isolated, you are so alone, you are anxious, you easily get into depression and then you give up. And a person who has given up and said, this is it, I'm done, can lead to death. When you give up on anything, I won't try that, then it leads to death. In premarital counseling, we are very clear about getting to know your status and your spouse's status. What are they? And if both of you are sicklers, what does that mean? We sit down and have a conversation. These are the things that can happen as a result of both of you getting married. Do you want to do that? And you might say no, because it's not only sicklers who say no. We have HIV, we have people who are like, no, you are too close in my relationship and I won't marry. Yes, I love you, but I won't marry. So it's a decision. So you go into this marriage knowing that problems might arise. You get into the marriage because both of you are sicklers. We sit and decide, do you want to have children? How are we going to manage this? So those are conversations for me that I would like to see happening in this sickle cell area, so that we reduce on the number of people who are born with sickle cells, so that we go in knowing that that is a possibility. 2, I am a sickler. I am making decisions about certain things. How am I going to do that? Pain management, for example. What is the new drug on the market? In the US, I know for sure there are drugs that have been introduced that are not yet in Uganda, that are not as addictive or even not addictive at all. But we have no idea. We have doctors that are working with us that are so ancient and, sorry to use that word, that are much older and have not gone into research to find out the new ways of dealing with sickle cell. It's a long-term pain management. How is it going to be handled? We need research on that. Can we allow medications that have been restricted in our country to be brought in, particularly to deal with chronic pain? And then, of course, it goes into what are the new ways of working with patients that are sicklers in terms of counseling. How can I keep up with this individual on a daily basis, weekly basis? Is there a tool that can help me do that? Those are all research things that we are not yet there. I'm willing to have conversations because some people have so many questions and they don't know how to ask them. They can't ask their mom, they can't ask their boyfriends, they can't ask their girlfriends, they can't ask their friends. But counseling gives you an opportunity to be yourself. You say, I'm scared. And the counselor will say, so what should we do? How do you feel? What do you want to say? What are you projecting? How do you see yourself in the next 5 years? And you are able to talk about yourself. And so these services are available. I do referrals. If I can't see you on a daily basis or as often as you want, we know people who can speak to you. And I think that's my role. And I am a trainer as well, and I think this is an area that I am going to include in the training that we do, so that we train counselors in how to deal with chronic pain. Much of cancer and what we have handled, but sickle cell is, I don't even want to call it a new area, but it's an area that, because many people don't talk, it's foreign to many. Parents get confused. Parents get discouraged. Parents give up. Parents at times regret why they didn't do something about it. So they blame themselves and they're like, if I hadn't had this child, maybe this wouldn't have happened. Because it goes back to, you trace it to the parents, really. And so I want to encourage them that it's not about blaming. A child is given by God. That's my view about it. And, whether you had tested or not, a child is a child. And so I want to just encourage you. This is your child. The Lord will strengthen you. But you need to have support. I encourage you to find support groups. Support groups of other parents that have sickle cell. How do they manage? Can you call someone and talk to them when you are at a point of breaking down? Because I know where parents have broken down and cried, because of the pain of their child. They don't know what to do. They've done everything that they can think of, and they do not know what to do anymore. Then they are worried also about addiction. I've given the child so much medication. This child is going to be addicted. This child is going to be ruined by all the medication that they are receiving. Being encouragers, because when you give up, your child will also give up. They're looking up to you. And if they see you are tired of working with them, never show that you are tired. Never show that you've given up. You need that courage. And I think that courage can only come from God. I know that because I'm a Christian, and that can only come through when you trust God and put it at the hand of God. Of course, there are questions about where is God in all this? Why isn't God taking care of that? It's a big, big question. But it reminds me of Job. Job had the same questions when he was in pain. He went to God and said, why is that? And God gave him a set of questions as well and said, do you know this? Do you know that? And one of the questions that amazes me is to do with the morning. He says, are you there when I open up the morning? And Job said, I don't even know that. You are the creator. You are. So I give up. I won't ask any more questions. So let's trust the God, the creator, who knows everything. He gave you this child. It's not a mistake.